Contraindication is something that can restrict or prevent a treatment from being carried out. A therapist needs to be familiar with certain conditions so they can prevent cross-infection and further harm to their clients from themselves and their future clients. There are contraindications that will prevent a treatment from being carried out. If identified, you must remain professional and advise your client that they may have a possible contraindication and refer them to see their doctor. Onychomycosis is a fungal nail infection and it lies dormant till the environment makes it suitable to grow. It can be seen as a yellow colour. Paronychia is a bacterial nail infection. It can be identified as pus-filled blisters and can produce redness, swelling or pain. Impetigo is a bacterial infection. It can be identified as pus-filled blisters and sores, and it's extremely infectious. Scabies is a skin condition caused by an infestation of the human itch mite. These microscopic mites burrow into the skin and cause symptoms of itching and rash. Tinea Capitis, also known as ringworm, is a superficial fungal infection. Symptoms include itching, a rash, or the skin around it may be flaky. Tinea or nail ringworm is due to a fungal infection similar to the type that causes athlete's foot. The skin around it may be flaky. Your client may have a flaky nail bed, and the skin around may look infected, or your client could even have athlete's foot. There are contraindications that may not stop a treatment from being carried out, but may restrict a treatment from being carried out, but can be worked around. Onycholosis is the painless separation of the nail from the nail bed. This is a common problem. It can be a sign of a skin disease, sign of an infection, the results of an injury, repetitive trauma, prolonged immersion of nails in water, or an allergy. Nails should be worn short. Psoriasis of the nail is not infectious. It can be identified as pitted nails, and nails should be worn short. Onychophagy can be identified as severe nail biting. You need to be careful around the cuticle area. Warts is a small lump that develops on the skin and is infectious. Avoid the area and use plasters. If you think that your client has a contraindication, it is important that you do not diagnose them with the condition that you think it may be, as you are not a trained medical professional and are not in a position to be able to do that. If you think that your client has a contraindication, you should inform the client that they may have a possible contraindication and that you cannot carry out the treatment as it may cause harm to the client. If they still wish to have the treatment, inform them that they should get a doctor's note or reschedule their appointment to when their condition is expected to disappear. Be professional and reassure your clients. If possible, offer an alternative treatment that is not contraindicated. Always record your findings on your client's record card for future reference. A contra-action is a reaction possibly caused by a treatment that is being carried out. If you are allergic to something, you will have what is called an adverse reaction. When a person experiences an adverse reaction to a substance or a chemical, it is necessary to remove the product or irritant from the body. Medical advice should then be sought if the symptoms persist for more than 24 hours.